welcome to this important thematic session on mental health in education. My name is Zeinab Hijazi. I'm the Global Technical Lead on Mental Health at Unicef headquarters based in New York. Mental health is a global issue, and this is reflected in the need. UNICEF's recent State of the World's Children 2021 report on mental health and well-being reaffirmed the mental health statistics around our world, which are quite staggering, affecting so many children, adolescents, and families, affecting the quality of life with enormous impacts tied to the global burden of disease. A key theme in our report centers around mental health and psychosocial well-being as critical to children's success in school and life. Children must be safe, protected, and mentally and physically healthy to be ready to learn. At the same time, childhood and adolescence are crucial periods for laying the foundations for healthy development and lifelong good mental health and well-being. Schools are also more influential on children's development than any other social institution besides their family. Schools and other learning environments, including early childhood education centers, bring children and adolescents together in safe environments where mental health and psychosocial support can be provided, referrals to complementary and specialist services can be facilitated, and quality and continuity of learning can be guaranteed. For children and adolescents at risk of poor mental health, early intervention can provide the crucial support, not only for them, but for their caregivers, their siblings, and other family members. During emergencies, integrating Mhpss within education responses can contribute to effective learning and help protect children from the negative effects of crises and adversity by creating stable routines, fostering hope, reducing stress, encouraging self-expression, and promoting collaborative behavior while ensuring access to the services that they need. And these are just some of the reasons why mental health in education must be prioritized and accelerated in our work across levels and settings. And here to talk with us about these reasons further and expand on what actions and accountabilities of different actors look like is an esteemed panel of experts that bring together strong technical and field expertise on the topic of Mhpss in educations. Panelists, I hand over to you to introduce yourself briefly to our participants, starting with Luiza, Patricia, Bore, and then Ashley. Panelists, over to you.
Hello, everyone. It's a pleasure to be here with all of you today. My name is Luiza Vilanova. I'm a young person from Brazil, and I'm here today to talk a little bit about this amazing topic and especially the intersection with education. I work at Unicef headquarters as a young ambassador and also at Tocando Frente as a social entrepreneur.
Thank you, Luiza. Thank you, Zeinab, for the invitation for this panel. I'm pleased and honored to be part of this session today for a very important discussion on a topic that we all agree is very important for transforming education. My name is Patricia Landinez. I'm a mental health professional, and I have been working on the field for more than the past 15 years with NGOs and also with UNICEF. And currently, I'm working with UNICEF headquarters with the education team, collaborating to mainstream and scale up Mhpss intervention across education. Over back to the next.
Yeah, thank you, Zeinab, thank you, Luiza, Patricia, Ashley. It's good to be here today and share what will be a field experience from the UNICEF country office of North Macedonia. My name is Pucoski, and I'm a psychologist. I have been working with the UNICEF country office for about 4 years now, and I've had the privilege to be involved in the design and implementation of a really interesting program for social and emotional learning, preschools, and yeah, I'm really happy to be here and share with you our experience. Over to Ashley.
Thank you so much, Zeinab, and all the other panelists. My name is Ashley Nemiro, and I'm the Senior Mental Health and Psychosocial Support Advisor for the Mhpss Collaborative. And my position is really leading our Mhpss and education portfolio. And that looks at research. So how do we integrate Mhpss into education? What are best practices? How do we integrate mental health and psychosocial considerations into pre-service and in-service training for teachers and education personnel? and just thinking about how we also disseminate research results and ensure that we everything that we're doing has an influence from global to local level. So really happy to be here today and speak about a topic that is so important, as all the other panelists have said.
Thank you so much, all of you. I'm really excited to learn from you today. Before we begin, I kindly invite all webinar participants to please send any questions or clarifications that you might have using the Q&A function or in the chat. Please remember to identify yourself, your affiliation, and the panelist you'd like to direct your question to. Patricia, I'd like to open the first segment with a question to you. Why should schools promote the mental health and psychosocial well-being of children?
Thank you, Sena, for the question. And I think the list of reasons why schools should promote mental health and psychosocial well-being is long, but we have a few minutes, so I will focus on the main 5 key big reasons. And I think one very important one is that because it is already a priority for children and adolescents, and Unicef has conducted some consultation over the past years with adolescents and young people, and they are saying that there is a need to have an increase or scale up mental health interventions in schools. They are also saying, that we like to learn more about mental health in schools. Second, because mental health is an integral part of our health, and it is also a human and basic human right. And having good mental health means we are better to connect with others, to function, and of course, to learn in schools and other learning environments. Third, because children and adolescents need to have open conversation about mental health in schools and decrease the stigma around mental health. And the earlier these conversations start, the better. And we often talk in schools and in homes about the importance of taking care of our physical health, but not that often we talk about the importance of taking care of our mental health. And schools is a good place to start talking and having this open conversation. Another reason is because evidence, and there's a growing body of evidence that confirms the importance of strengthening the capacity of schools, but also of early childhood education services to promote health and mental health and assist children and families dealing with mental health problems. Mhpss, or mental health and psychosocial support interventions in the schools, have proven to enhance student well-being, the sense of purpose, connectedness, and meaning, and also improve academic learning, engagement, a sense of connectedness with learning and with the schools, and improve the staff well-being, and more. And last but not least, we cannot talk today without talking about COVID-19 pandemic and the impact that it has had on the learning and health and mental health and well-being of children and teachers, and how this crisis has also raised concerns for the mental health of children and adolescents. But the COVID-19 also reminded us about that schools, in addition to providing education, are uniquely positioned to offer learners and students with a comprehensive set of services and programs that promote and respond to their mental health and psychosocial well-being needs. And despite the long and vast challenges posed by COVID, the pandemic can be also an opportunity to make changes and to take actions towards transforming education system in the long term. And in this transformation, it is critical to ensure we are making progress and ensure the schools are strengthen their capacities to promote and protect children's mental health. And I hope I didn't take too much time. Let me pass over back to you, Zeinab, for the next question.
Thank you, Patricia, for these thoughtful insights and really bringing clarity to the role and evidence, as you said, that schools play in promoting and protecting children's mental health and well-being. As you mentioned, we witnessed this in the context of COVID-19, where school closures translated into a loss of the comforting routine of school, sports, recreation, and friends, and opportunities for social and emotional development. But I also love that you ended it with a really positive note about, building back better and how could we transform schools and education settings into better environments for our children. So thank you so much for that thoughtful response. I will now turn to Luiza. More than ever, young people are on the front line of solutions related to their own mental health, as well as mental health services within their communities and even globally. As a young person yourself and as an advocate for mental health, can you tell us why it is so important that young people have access to mental health and well-being support within education?
Yeah, definitely 100%. I feel like after the pandemic, especially, it was amazing to see how many young people started to think about their mental health more carefully. And I like to say that quality education does not only change an entire community, but also create change makers. And for our quality education, what that actually means is access to social emotional learning. And it's super important because when you have access to those type of skills, you're empowered to actually be aware of your own community, context, and act upon it. So I feel like access to those type of abilities are extremely important to make sure that we are empowering young people, but also teaching them how to interact with others and actually pay attention to what their own needs are. So I like to tell one brief story after all of those amazing evidence that Patricia just shared. That is about two people from the same community, one young girl who was dealing with bullying and violence inside school and did not understand what was happening around her, and another one about a young boy from the same community who was dealing with extreme poverty. His father just died because of drug traffic and a lot of other really impactful and dangerous factors that were happening around that community. The first one was able to have access to therapy and ended up writing a book about the entire experience, and was able to actually think about her context and act upon it, creating a project to end bullying in her own community. The second one was a kid that was part of that project. At the beginning, did not want to be part of any activity and interact with other kids, were extremely violent and did not understand what was happening, just wanted to go to school to eat basically and go to lunch. So it was extremely hard to deal with that boy at that time because of all of the background that was happening. And after going through the social emotional learning curriculum, he was able to communicate his feelings, learn more about teamwork, and actually dream, which is something that we don't actually think a lot about in mental health context, but I feel like it's an extremely important aspect of making sure that they are empowering young people, especially thinking about the role of mental health. So at the end of the activities, and I was the first young person who had to deal with that really harsh experience inside a school environment. That little boy that was participating in our activities, he came to me in the last day of the curriculum, hugged me and said, Lu, because you believe in me, I decided to be a lawyer. So that's what mental health does. It makes children to believe and recover their right to dream. So I feel like it's really important to also see that aspect of mental health and social emotional learning that is empowering for young people, especially.
Thank you so much, Luiza. I love what you said about the pandemic creating change makers, and you are certainly one of them. You touched on schools being important for mental health, but also environments where, like you said, people experience violence and other protective challenges. So how do we create schools that are kinder, gentler places for young people? To do that, we must prioritize mental health in schools, and at the heart of it all, engaging young people directly and meaningfully in all that we do. So thank you again for that really thoughtful response. Bore, coming to you now, we'd love to learn from your experience in North Macedonia. Can you lay out for us how can we meaningfully, safely, and effectively educate young people in schools, including in preschools, about their mental health and ways they can access support?
Yeah, thank you so much, Zeinab, for the question. Well, to give a bit of a context for the participants to the webinar. Schools in North Macedonia are well equipped with school support staff. This usually means that the majority of schools would have a team of multidisciplinary professionals, a psychologist, pedagogue, a special educator, etc. At least 2 of them. And they are all tasked with supporting the school in their respective areas. However, they are not receiving the required amount of professional development to advance their skills. They are overburdened with administrative duties. And this has led into a culture where you're only seeing the psychologist if you're in trouble, and let's say the pedagogue if you have trouble with your grades. In order to overcome these issues, we employed a paradigm shifting approach. So we started in 2018 and focused on preschools in a way to build a foundation of social and emotional skills on which we'll build upon later, so that students are well-versed in mental health terminology, vocabulary, they are able to express their feelings, and they are able to seek the support, but also schools are able to provide the support that students are seeking. And this has led us to the development of a social and emotional learning program, which aims to provide teachers with the skills, the content, and the strategies to meet specific developmental needs of young children. But also, as I said previously, to help them acquire the vocabulary and overall competencies in social and emotional development. When I talk about competencies here, I'm referring to competencies like self-awareness, social awareness, self-regulation, responsible decision-making, etc. And as Luiza said, when these mature into change makers, adults with skills like these are very much needed in our world today. So the way that we approach this is to actually co-develop the program jointly with the preschool teachers. Although it's based on several evidence-based models like the Johns Hopkins Brain-Targeted Teaching and Yale University's Ruler program, it's actually tailored and co-authored to a degree with teachers who are working in the local context. We have also engaged multiple TV producers to extend the reach of SEL content, social and emotional learning content, into TV far beyond the classrooms. But to further my elaboration here, we started with a pilot project of kindergartens. And this piloting initially showed that through play, exercises, storytelling, preschool age children, thanks to the program, are better able to express their feelings, they get along better, they show empathy for others in the group, and they care more about the environment in which they're in. We started with a pilot group of teachers who are now providing peer support to their colleagues, and eventually we reached all preschool teachers in the country, all kindergartens. But just before we reached all of them, COVID-19 pandemic broke out, and we actually relied on these teachers to kind of give a sort of sense of normalcy during the first school closures. And these were the first teachers who showed up on national TV and through a TV classroom project, reassured children, continued with this support. And yeah, it was really an invaluable resource in a very stressful time. This momentum was built on by the country office. We organized a conference to stress the interplay between child well-being and academic attainment. I'll post the link for the participants in the chat. But we are now proceeding with the plan to now develop, which is currently ongoing, a mental health and psychosocial support program for primary schools, which would build upon the successes that we've had so far. And again, this program aims to shift the narrative where psychologists would only react to symptoms and learning difficulties, to an approach that aims to build up the positive skills, the strengths, the resiliency in students themselves, so that we are preempting more serious mental health issues and empowering children and students to seek out these opportunities and to grow their skills and support their own mental health and mental well-being. Thank you.
Thank you so much, Bore. I particularly appreciate your description of the challenges in creating social and emotional learning environments, which must prioritize capacity development of teachers, including support to their own well-being. And also, I think one thing that resonates with me as well is from your experience in talking about creating a system that not only responds to children's needs in times of crisis, but also ensures that we are taking on an approach that promotes mental health and psychosocial well-being and includes those important preventative measures as well. Thank you so much for that, Bore. Ashley, I'd like to close this initial round of questions with you to bring in the very important emergency-specific considerations and highlights to the discussion. Ashley, why is it so important that young people have access to mental health support within education, especially in emergency contexts?
Thank you so much, Zeinab. So mental health and psychosocial support approaches and interventions and education services for children in conflict can really be imperative to overcome the impacts of these chronic adversities and loss of learning opportunities that we all know are all too common. When education settings are places where mental health is promoted and mental health considerations are woven throughout the curriculum, learning spaces can serve as protective environments that really help to restore a sense of normalcy, promote healing and recovery, especially for those children that are often living otherwise disruptive lives. So when we think about the role of education systems historically, it's to help children learn skills like reading, math, and arithmetic. It's posited that these skills will help them to one day grow into adults and be active members of society. Education settings can actually provide so much more for children outside of these skills. Although they're extremely important, they're only one piece of the puzzle. So when children have access to mental health supports in schools through universal prevention initiatives, social and emotional learning that my colleague just spoke about, and early detection and care, it's been shown to enhance academic achievement and improve school attendance, as well as lowering levels of stress, anxiety, and depression, and not only for students, but actually for teachers as well, in addition to improving social connectedness and coping. So if improved learning outcomes is actually what we seek in education settings throughout the world, and specifically in humanitarian settings, mental health support in education should be one of our biggest priorities. And there actually needs to be a big paradigm shift away from traditional education systems that rely on rote learning. So children spend a significant amount of their time in learning environments. And if mental health and well-being is not integrated throughout these systems, we're doing children actually a huge disservice and not paying attention to the fact that the majority of people experience the onset of mental health conditions by their mid-20s, with half experiencing onset by age 14. This is even more important in emergency contexts where children can be especially vulnerable. They can be exposed to chronic adversity, grave violations of their human rights, insecurity, deprivation that we know lead to poor mental health and psychosocial outcomes. So education systems that provide mental health and psychosocial support can really help to mitigate these risks. And as previously mentioned, serve as spaces that promote healing and that promote recovery.
Thank you. Thank you so much, Ashley, for speaking to MHPSS as imperative in emergency response and the role of education beyond academic achievements, as you said. I think integrating mental health in schools can have critical impacts on children's emotional and overall development and well-being. And I draw parallels between what you said and Patricia's comment about transforming education and needing this paradigm shift in the way that we approach education in children's lives so that they could really excel and thrive both in emergencies and non-emergency settings. Great. So before I move on to the second round of questions, just want to remind everyone to please use the Q&A function to pose questions to our panelists. We would really love to have a chance to engage with you all after the second round of questions. Patricia, you spoke to us about the importance of MHPSS in schools. We know that there is much to do to realize our goals, including at the policy level, and the need for a country-level system approach to this agenda, which brings me to my follow-up question for you. What are some of the key findings and recommendations that UNICEF will be highlighting in its forthcoming policy brief around the Transforming Education Summit later this year?
Thank you, Zeinab. For those that don't know what it is, the Transforming Education Summit, very briefly, that last year it was announced by the UN Secretary General, Antonio Gutierrez, a Transformation Education Summit that will happen in New York this September. And there's also a pre-summit at the end of this month in Paris. And this summit will bring together global, national, local education stakeholders, actors, and authorities to dream about how we imagine education system in the future. And this is a great opportunity to have a global dialogue on how we want to transform education systems in the long term. And this is a unique opportunity for us to transform an education, to strive for the promotion and protection of mental health of children and teachers in learning environments. And we are taking this opportunity to ask policymakers, government, private sector, donor, mental health practitioners, educators, coalition, advocates, young people to join efforts and help us to strengthen the education system by developing and increasing, evaluating, generating evidence around long-term and sustainable school-based mental health, psychosocial support policies, programs, strategies, and services. And of course, we all know that there is not a single formula to do so, and programs and services must be adapted to the different contexts according to the needs and also the resources available. And now to the point you asked. Although we know that there is a not single formula, we are suggesting that more attention needs to be given to one, increasing mental health literacy of students so they can again can talk openly, about mental health in the schools, but also in homes. And that could be done, for example, by integrating mental health literacy and social-emotional learning in the curriculum. We are also suggesting to provide learning opportunities for teachers and educators so they can strengthen their own knowledge and capacities to promote the student mental health within the classroom in a systematic way, not one training here, one over there, or one workshop here, but systematically in pre-service and post-service training, but also ensuring that not only training, but they also have support from MHPSS or mental health professionals that they can provide technical support when they need it. And increasing their capacity to create this environment where every child feel they belong and they're accepted and they participate in the school environment. Also, it's important we're highlighting the importance of supporting teacher well-being. I think that was even more clear during COVID-19, and that was really evident, the importance of taking care of the teaching profession and how it's important to support their well-being, and especially during emergency. Not only, but during emergency most. And last and not least, we are also asking for increased investment and attention to mental health services within schools, whether those services, like in North Macedonia, can be provided within the schools, or ensuring there are linkages and coordination across sectors to ensure that those children that need a more complementary or specialized support can have access to it through schools. But for this to happen, really, we need strong country leaderships. We need large-scale investment. We need coordinated efforts across sectors, and of course, school-based policies and programs that are relevant and responsive to the context and evolving needs of the children according to their age and their different abilities and needs. So just to end, to reiterate again that this is a critical moment and a great opportunity for us to influence this Transforming Education Summit. So during the Transforming Education Summit in September, we will be launching this policy brief on Mhpss in education, and again, calling on governments, donors, and partners to prioritize mental health in the education sector. So this generation, but also future generation of children and adolescents can learn in a safe, nurturing learning environment that protects and promotes the mental health. So we're hoping we are all joining efforts in this Transforming Education. Thank you, Zeinab, and over back to you.
Thank you so much, Patricia. It'll be really wonderful to use this policy brief as an advocacy tool and a really clear call to action for governments to incorporate and adapt the essential components that you just laid out, the essential components of a mental health and education policy across the development humanitarian nexus. So thank you so much. We're looking forward to the policy brief being launched at the special Mhpss side event to the Transforming Education Summit. And thank you to Emma, who has included a link to the Transforming Education Summit for you all to learn more about the events that are scheduled during that time. Great. So Luiza, I'd like to come back to you as well with a follow-up question. And again, from your perspective as a young advocate for mental health, what recommendations do you have about how to best support mental health and well-being through the education system in schools and in universities?
That's a really hard question, but I feel like something that I've been thinking a lot about is a quote that I heard in a Unicef panel. One young advocate said that nothing about us should occur without us. So that's a really interesting framework to think. And I feel like having community-centered initiatives for mental health is extremely essential. And our work, in my work in Brazil, for example, and around the world with mental health, it has proven that to be true. So, for example, when you go to a different community that is more conservative, where there is like other cultural traits, it's really hard to talk about mental health because it's still a taboo. So in order to be able to like bring that knowledge and bring that advocacy and talking, it's really important to have people from that community, and especially young people who are more aware, talking about it, especially with policymakers and other stakeholders in the environment. It's really, really important to make sure that those conversations are happening and intergenerational talks are actually occurring to make sure that we have really that flow of information and different perspectives coming in to further develop what mental health is from a specific community. So I feel like that recommendation is really, really important. I feel like Patricia's point about investment is also really key. In Brazil, for example, right now, our politicians are not paying a lot of attention and directing part of our budget for mental health specifically. It's still a big taboo in the country and all over Latin America to talk about what mental health actually means and the impacts it has for the economy, for the social development of a certain country, and for education standards, for example. We still are like looking for mental health as a plus and not as something essential for the development of a certain country. So I feel like that's another perspective that needs to change. And we only change that through more awareness. And I feel like young people are incredible allies in making that shift like to happen. So I feel like that's an important aspect too. And lastly, I feel like the methodology is also really important, and it has to be the national curriculum. So like when you don't have social emotional learning in a country's certain national curriculum or in a city public school system, it's really hard to make sure that those who are most in need are having access to that like knowledge. So it's really important to make sure that we also implement that in the school curriculum and in the structure themselves to make sure that we have a more institutionalized approach, because the teachers are really starting to understand even more the importance of bringing social emotional learning to schools. But it's really important to make sure that the government becomes an ally in that fight, and making sure that we have like further efforts of making social emotional learning more available for everyone, no matter their socioeconomic status, which schools they go to, and which community they're a part of. So I feel like those are three really important aspects of making sure that happens. And more specifically about our methodology, something that we also realize, especially at Tocando Frente and other NGOs that are youth-led around Brazil and the world, especially Latin America, we saw that if you only talk about mental health and be like, hey, mental health is important, let's end bullying, for example, and you explain why bullying is wrong and things like that, that won't have the same impact of making sure to have a gamified approach, a play-centered approach for kids, showing them through action why it is important. So when you put them into a scavenger hunt, a group of kids that are 10, 8, to like find a treasure in their school, and you have them working together, a lot of the skills the board, for example, was talking briefly about are going to be practiced. So it's really important to also think about a methodology we are bringing in. And again, young people are great allies to make sure that it's happening.
Thank you so much, Luiza. You started your response with the slogan, "Nothing about us without us." And this is a slogan actually originally coined by activists working in the disability and inclusion space, and has become critical in driving an MHPSS, a mental health approach that is inclusive and participatory and meaningful, because it builds on the needs of young people and their engagement and role in developing and driving those actions and the policies that impact them and their communities. Thank you so much for that, and also bringing light to issues like equity, as well as the methodologies that are critical for us to be able to truly and meaningfully engage young people in these actions. Lore, I would like to come to you once again with another follow-up question. What lessons have you learned about how to best support mental health through the education systems in schools in North Macedonia?
Thank you, Zeinab, for the question. I would like to reiterate what Patricia said before. Working on teacher well-being is a prerequisite for mental health and psychosocial support in schools. The program, the social and emotional learning program that we developed, dedicates the better part of the program, the first weeks of the program and professional development, dedicates it to the well-being and mental health of teachers themselves. Through techniques like journaling, gratitude expressing, peer support, we really focused on the well-being and mental health of teachers. This is especially important for early childhood education, because with children at that age, teachers need to model that behavior. They need to show social and emotional competencies to children, because children will pick up on all of those subtle keys and nuances of the state in which the teachers are in. So really focusing on the teacher well-being, it may be slower, it may be costlier, but it's a prerequisite for successful MHPSS programs. The other important aspect, and the lesson that we learned here, is that teachers need to be involved in the development of the programs. A lot of the language that is used for mental health is still, as Luiza mentioned, it's still a bit of a taboo, so teachers need to feel comfortable with the words that they are using. For example, self-awareness. In some languages that may not be as domesticated as a term, it needs to be verified and essentially adopted by the teachers if they are going to use it. So it's really important to involve them in creating these programs, involve them in creating the content. They have tons of ideas for games and activities. Involve them in creating the resources that are going to be used so that they feel more ownership and a sense of agency in these programs. I would also like to add that a lot of the professional development opportunities would cover teachers, at least for our country, and extensively would cover teachers, but not mental health professionals, not the psychologists in schools. And they are, I'm sure, in many places, really outnumbered by the sheer amount of work that they have to tackle in a school. So it's really important to invest appropriately if we want to see all the benefits of mental well-being of children. These translate into student achievements, translate into quality of life, translate into the well-being of our communities and the world in general. So we really need to dedicate the time and the resources to make this a meaningful effort. Thank you.
Thank you so much for the focus on mental health and well-being of teachers who are the main source of care and nurturing for children must be prioritized. And thank you as well for widening our discussion today regarding participation, because yes, this includes children and young people, but it also includes teachers who need to be at the forefront also of developing those methodologies, developing those programs and trainings that are really meant to serve and support the children within their care. And all of these, as you said, are ingredients for translating into environments that are supportive to that are supportive and also protect the mental health of young people. So thank you once again. Ashley, I'd like to end this second round of questions with you. What lessons have you learned about how to best support mental health through the learning environments in emergency contexts?
Thank you so much, Zeinab. And you'll hear me echo a lot of the things that my colleagues have beautifully stated. And to answer this question, I'll summarize 2 recently released articles that I worked on with colleagues to compile learning about how to support mental health and well-being through learning environments. So in one article, we developed through a very large consultation process, core actions to enable a shift towards education that is responsive to children's mental health and psychosocial needs and learning requirements. And this is specific to humanitarian settings. So the first core action is to engage communities, including children and youth, meaningfully and safely in the design, inception, and evaluation of any humanitarian programming and research. So more specifically, work with existing community structures and ensure youth, caregivers, teachers, and all education personnel and community members in fact inform MHPSS programming in education and learning spaces. Secondly, working alongside caregivers to promote the well-being and learning of children early in the life course. So investing in early childhood development in the well-being of caregivers is critical to mental health and psychosocial well-being and really supports the trajectory of children's learning. Work with national education systems and advocate for the inclusion of MHPSS programming within education services and teacher training. So both in service and pre-service training. Building upon and integrating it into existing mechanisms, programming, and national curricula. Create national sectors plans that are inclusive of MHPSS and link education services to health and social welfare systems. As a cross-cutting issue, MHPSS is linked across all humanitarian action. And we want to ensure that there's functional referrals up and down the layers of the IASC MHPSS pyramid of interventions. So it's not just about integrating in education systems, it's ensuring that those other services exist to support children in need. So advocate for access to flexible multi-year and multi-sectoral funding geared towards integrating learning and well-being outcome in all humanitarian response. And I will share these articles that I'm speaking about as well in the chat function. So the second article looked at mapping which interventions work, focused on evidence for program theories, how interventions work, focusing on theories of change, measurements, and intervention implementation. and for whom interventions work for in MHPSS and learning environments. So we often see that there's general statements around safe and enabling learning environments across much MHPSS and education literature, but little elaboration on what this means and why interventions actually work in humanitarian settings. And to really understand this, we developed 11 program theories around education and MHPSS. 4 of the program theories were at the child level, 3 at the teacher level, 2 at the caregiver level, 1 at the school environment, and 1 at the school management and administrator level. I don't have enough time to go into this now, but what we developed from them is really highlighting, Zeinab, you just talked about the ingredients. So we highlighted the ingredients needed when providing mental health and psychosocial support in education settings. And really through this process, there was ample attention given to the shift towards more holistic, whole school approaches to MHPSS programming. So rather than single component interventions rolled out in learning spaces. So looking at whole school approaches, which touch on exactly what my colleagues have been speaking about here today, making sure that teacher well-being is supported, making sure that there are systems in place to support children who may be in distress in humanitarian settings, so that there's more multi-sectoral programming. So overall, our research emphasized that many levels of actors, so school leadership, teachers, staff, caregivers, are all critical to creating these safe and inclusive learning environments for children. So we really have to look at the social ecology of the child. While we did not see a lot of emphasis on caregivers and other non-school centered aspects of enabling environments in the literature, we know this is such an integral part to more holistic approaches to MHPSS in education. And I want to highlight that really this was an expansive literature review in humanitarian settings. We know a lot of this programming is happening. Of course, we have anecdotal evidence. There's a lot of program examples, and so just highlighting those theories of change and what we think through a consultation process are very important whenever you're doing MHPSS in education programming. Thank you so much, Zeinab, and back over to you.
Thank you so much, Ashley. You covered so many wonderful things. And I think one of some of the points that really resonate with me are the ones that you made around community engagement, around acting early and early childhood development, and the well-being of caregivers, and about creating this, multi-layered, multi-sectoral system with MHPSS, and where education links to other sectors like health and child protection. And I think this is such an important point because these are really needed. And I think Patricia mentioned this as well, this kind of collective action that is really required to strengthen resilience and reduce developmental and societal risk factors, as well as address service access issues and disruptions for children, adolescents, and caregivers. Thank you so much, Ashley, and to all the panelists for engaging with us in these Q&A segments. So now I open the floor for questions to our panelists and any reflections you'd like to share. There are already quite a few questions that are coming through. Please be patient with me as I try to kind of allocate the right questions to the right panelists. So there is maybe perhaps 2 questions that relate to one another. The question reads, there is a culture in place almost worldwide prioritizing results in schools and putting a lot of pressure on getting results. How can mental health curricula address this culture? Wondering who might want to take this question from the panelists.
I would love to reply to that question as someone who is currently at university and attending a really pressured environment in college. So I feel like something that we at Tocando are thinking a lot about is how a lot of times school environments do not prioritize different talents. We only think about the kid who is great at math or the kid who is great at writing, or we have a hard time prioritizing different types of intelligences and also what it means and redefining what it means to be smart in a certain environment. So I feel like our first step into including mental health inside co-curriculum also relates to embracing different talents and making sure that we are advocating for different perspectives inside the classroom too. Because if the professor only praises, oh yeah, you are great at math, so like continue being super smart, you're number one in the class, that will create an environment where the kids who knows a lot about what they are feeling in a certain moment, it has that like intrapersonal intelligence, or the other student who is an amazing leader and is always great at like bringing people together and doing amazing work with interpersonal intelligence, will not make a difference inside a classroom and will not be recognized for their intelligence. So I feel like the first step always goes back to like making sure that mental health is also about embracing different talents and creating an environment where every kid and every student feels like they can shine no matter what their abilities are.
Thank you so much, Luiza. Very, very well said. Another question that we have, and maybe perhaps this one looks at governments and policy. So I'm not sure if maybe Patricia or Bore would like to take this one. So as mental health advocates, we often focus our influencing of governments on health ministries. With the education sector being so important, how can we best engage and influence education ministries? And do we need to speak a different language to how we speak with health ministries? It's such an important question. And I think it comes back to the SG call to action to ensure a whole of government approach as it relates to MHPSS and the important role that education and social and child protection government arms also play. So wondering, Patricia, maybe perhaps this also relates to the policy brief that you're developing. So over to you to respond, please.
Thank you very much. So I will try to be brief, but this is all about, I think, transforming education summit as well, where, you know, all governments and education authorities will be there. And that's what we're doing to, you know, to speak with evidence and also with experience from countries about the importance of integrating mental health in education. So my answer is we need to engage more with Ministries of Education, not only with Ministry of Health. We need to engage more in a coordination between the sectors, and not only health and education, but also other sectors that are involved in the promotion and respond to mental health of children and adolescents. I don't think we need to speak another language. Maybe we just need to make it, more understandable for educators and related with evidence that shows the importance, as we know, of integrating this type of programs and how it is important for the holistic well-being of children as well as for the learning outcomes. I hope that answered a little bit the question.
Thank you so much, Patricia. Bore, there are two questions that I think relate to one another around caregivers' roles. So in the chat, somebody asked, how do we make sure we include caregivers in different initiatives? And in the Q&A, there's also a very similar question around, how can youth who come from backgrounds where their caregivers are not adequately educated on mental health and may not support them to be included in conversations on policies? They may not be able to come forward on their own, but suffer more than most. So this, I think, ties into one another because it's all centers around our role in working with caregivers as well as part of MHPSS in education. So over to you, Bore, if you can share your insights, please.
Yeah, well, I'll for this question, I can just point again to our experience in involving the teachers early on to the design of the program. We would really hear a lot of constraints and issues that we were not able to foresee when working on the first drafts of the program. Maybe terminology issues, maybe practices which some communities may find not in line with their values, or even offensive for some religious community. So this really needs to be very well planned out and involve teachers early on into the design of the program. Well, the question also focuses on youth who come from diverse backgrounds, and maybe if the caregivers are not sensitive or attuned to that. This is what Luiza was previously mentioning. Children also need to be part of this. While it's definitely more difficult for early education programs, still the effort needs to be made so that we account for their cultural specifics, and making sure that whoever is working with them is well aware of what their needs are, what their values are, and system of beliefs. But I would also like to maybe share an example for the question you posed previously about how to communicate with education stakeholders. There is plenty of data that shows positive correlation between mental health aspects and student outcomes. I mean, you can just point to lots of surveys that link, for example, a sense of belonging to a school and overall student outcomes. But I'm sure that education authorities are aware of these statistics. But what we have noticed is that whenever discussing mental health with education stakeholders, oftentimes the discussion will shift towards individual cases which require a multidisciplinary approach, and then we get stuck into this medicinal model of thinking about mental health in schools. This is where we need to share and shift this dialogue to say that all children need mental health support. It's not just the ones who are struggling or who need a multidisciplinary approach. Every single child in the school needs to be supported, needs to feel a sense of belonging, a sense of I don't know, identification with his school, confidence, self-regulation, things like that. So it's really important to shift the dialogue from these individual cases to a more holistic, whole school approach to mental health. Yeah, thank you
so much for it. I'm really conscious of time, but I do want to make room for just one more question. If you can kindly answer, Ashley. The question reads, do you have any thoughts on if climate distress and anxiety, indicated as most prevalent among young people, needs to be incorporated into mental health efforts within schools, and how to best do this? In less than a minute, please.
The very short answer is absolutely. So Luiza was saying that schools are really a place where where leaders are created, where the next generation of change makers are created. And so if we are not talking about the climate crisis within education settings, once again, we're doing children a huge disservice, because this is on children's minds constantly. It's hard not to be. And as you mentioned in the question, we talk about eco-anxiety and eco-grief. And just like we're talking about mental health and psychosocial support more broadly, introducing that into the curriculum, talking about it, engaging children in climate change and ecological crisis activities, really having children themselves and adolescents given the space to come up with solutions to really act as change makers in their society. I think we can no longer not talk about the climate crisis. Thank you so much, Zeinab. Hopefully that was quick.
Beautiful. It was perfect. Thank you so much, Ashley. Before we draw to a close, I'd like to ask our panelists for a final statement in the form of a tweet-length response to the following. At the UN Transforming Education Summit in September, we want to see ... for you to fill in the blanks. I'm going to start backwards this time. I know, Ashley, we've been ending with you. I'm going to start with you this time, and then Bore, Patricia, and then end with the lovely Luiza.
So at the UN Transforming Education Summit in September, we want to see the inclusion of mental health and well-being as central to any education response, not only for students, but for teachers, school leadership, and caregivers, really thinking of the whole social ecological system that surrounds the child. Thanks so much, Zeinab.
Bore.
Yep. I'll go to the same place as Ashley did. We want to see that teacher well-being is recognized as a prerequisite for any quality mental health and psychosocial support.
I think I will go with the investment. We need greater commitment and greater investment from the public, but also private sectors to ensure mental health programs and services in schools are available and reach those most in need, and in the poorest countries. I think for so many years, mental health has been unfunded, and we need to end this gap. And this is an opportunity to place this ask.
At the summit, we need to see a lot of young people engage in those conversations and making sure that they are also talking about how mental health is essential for not only empowering them, but bringing them the skills and the mental well-being to making sure that they are happening inside their communities, making sure that they're becoming change makers. So I feel like that's really key, and I would love to see that happen in the summit.
Thank you, Luiza. Thank you, everyone. This brings us to the end of our session. I want to thank United for Global Mental Health for giving us the opportunity to highlight MHPSS in education at their annual meeting. You set great standards for convening, and we are grateful to be partners in this important work. Thank you to Patricia, Luiza, Bora, and Ashley for your important contributions today, and we hope to continue this dialogue in the lead up to the Transforming Education Summit and other big MHPSS moments later in the year. Have a great rest of your day, evening, everybody.